Okay. I would wash my hands. Okay. Okay, I'm going to perform a head-to-toe assessment. Is that okay with you?
Yes.
Okay. So now I'm going to start. Okay. So to inspect her overall skin color, looking for color, temperature, rashes, irregularities. Okay. So if she was pale or jaundiced, I'm gonna palpate your scalp. Tell me if there's any tenderness. Is there any?
No.
Okay. Now, I would assess her level of consciousness and document all those things. Okay. Now, I'm just going to assess your facial muscles. Will you wrinkle your forehead? Okay. And close your eyes. Okay. Puff your cheeks out. Okay. Now clench your teeth and smile. Okay. Now, try and open your mouth against my hand. Oh, close. Try and open. Okay. Now try and open, but don't let me. Okay, I'm going to palpate your arteries. And, I'm going to palpate your jaw. So move your jaw side to side. Open your jaw and move side to side. Okay. Okay, so I'm going to try this again. So just try and separate your... Okay. Now, I'm going to palpate your sinuses just lightly. No, it works. Just goes, my screen goes blank, but that's okay. Okay. So now I would assess her vision with the Snellen chart. I do not have a Snellen chart, but I would have her read off the letters, and what she would be able to read at line 20 would indicate 20/20 vision. But I'll have her read a few lines from this magazine. So you could just read whatever you would like off of here.
Our first foundation that fits skin tone and texture. Pores and shine disappear with blur and micro powders.
Very good. Okay. Next. Okay, I'm going to test her vision. Okay. All right, first I'm going to have you cover one eye. And this is my pen light. Just say now when you can see the object.
Now.
Okay, now we're going to switch. The same thing.
Now.
Okay. Now. Okay, I'm going to have you follow my hand with your eyeballs. Okay. So I would just examine her conjunctiva, looking for color and clarity and any irregularities in both eyes. Okay, looks good. So I'm going to assess her pupils. So all you need to do is just look straight forward. Okay. And now I'm just going to have you look at the wall and then look at the pen. Okay. So her pupils are equal and they're round to light, and accommodation is good. Okay. I'm going to examine her ears. Okay. Position is good, the skin is intact, no irregularities.
Great.
Okay. Now is there any tenderness when I push on
No.
your ears? Okay. Now I'm going to whisper something into your ear and just repeat what I say.
20 candles.
Yeah.
15 pillows.
Good. Okay. So now I'm going to inspect her nose. Symmetrical position is good. There's no lesions. Very good.
Thank goodness.
And each nostril was open and patent. Nothing was blocked. Okay. So can you open your mouth? I'm just going to inspect your mouth. Say ah. Okay. The mucosa is moist. Now let me see your gums and your teeth. Okay. Gums are pink. Moist. Her tonsils were normal. Now, their palates were intact. Okay. Okay, and I'm just going to inspect your uvula one more time. Okay. And now I would assess the gag reflex. I'm not going to do it to you. I'm not going to do it to her, but I would use a tongue depressor and force a gag, and she would make the gagging movements, and it would be a positive gag reflex. Okay. Okay, so can you just stick out your tongue for me? Okay. And it was symmetrical, it was midline. So now, there was no odor, halitosis.
Thank goodness.
Okay, I'm just going to inspect her neck. There's no pulsations, there's no lumps. Her trachea is midline. And I'm just going to lightly palpate for your lymph nodes. Okay, and then feeling for her carotid. One side. Okay. So I felt her carotid pulse. Now. Okay, I did the trachea. Now. I'm going to test range of motion for your neck. So, can you turn your head this way? Then the other way? Look up. And down. And now, ear to your shoulder. And the other side. You shoulder shrug. Good. Now. Okay, so you're just going to resist my hand. So try and push my hand away with turn your head to the right. Okay. Other side. Try and go up. And down. Okay. Okay, so I'm going to assess behind you. Okay. I'm going to just reach around your neck and feel for her thyroid. Okay. And I would inspect her posterior chest for any lumps, irregularities, skin irregularities, rashes, and symmetry. Palpate, just lean forward a little bit. Is there any tenderness upon palpation?
No.
Okay. Okay, and I would palpate her spine. It's midline. Okay, will you just take a big deep breath in and a big deep breath out? Okay, and there's symmetrical chest expansion. Okay, I'm going to have you scooch forward a little bit more. Put my pen light down. And I'm feeling, take one more deep breath in and out. And out. Okay, and I felt for the costovertebral angle. And I'm going to lightly percuss. Any tenderness?
Nope.
Okay. And I'm just gonna put my pen light down, and I'm gonna listen to your lung sounds. So just breathe a couple deep breaths in and out. Let me know if you get dizzy. In, out, in, out. You okay?
Yes.
Couple more. In. No. 2 more. In and out. In and out. Okay. Now I'm gonna listen to them anteriorly.
I'm a runner. You should be good.
Deep breath in and out. Sorry. Okay, your respirations are normal and symmetrical. And I would also have the patient remove their shirt, look for any abnormal skin characteristics, any discoloration, rashes, cyanosis. Now, okay, I'm gonna have you. Okay, just lean forward a little bit in the chair. Okay, take a deep breath in, exhale deeply. And exhale. Okay. Now I'd be listening for murmurs, any other irregularities. Okay, so I'm going to have you put your hands out for me. I would assess her hands for temperature, cyanosis, skin symmetry, nail shape. They're consistent throughout, and her capillary refill is good. The color is normal. There's no cyanosis or jaundice. I'll have you keep your hands out for me, and I would palpate all of her joints. Is there any tenderness?
Nope.
Good. And skin turgor. It's fine. I'm going to assess your pulses also, so you can just keep your hands out. So assess for the brachial pulse. On the right. And the left. And we're just going to palpate the brachial pulse on the right and the left. And I would palpate her lymph nodes also. Okay. I'm going to assess the range of motion on your shoulders. You can put your hands above your head and bend the elbows down and up again, all the way down, and reach them behind your back and down, and up to the side and down. Okay? And can you rotate them forward and backward? Okay, and put them in front of you and flip them up and back. Okay, and flip your wrists and down. Okay, and now I'm just going to measure those same movements against resistance. Push your arms up and try and push my arms up. Okay, and down. Okay, and keep them up to each side and inward. And now your wrists. Try and push them up and down. And now grasp my hand, squeeze my hand. Okay. And can you squeeze your hands in and extend? Okay. Spread them. I'm sorry, I forgot you spread them. Good. Okay, now can you touch each finger to your thumb? Good. Okay, I did your grasps. Next is, I would assess her neck with my pen light again for jugular venous pulse, and there's no distension. You turn your head to your right side a little bit. Okay, now to the other side. Okay, and I would assess her abdomen for any lumps or heaves. Okay, I'm gonna have you lie down now. So I'll move this chair over. Okay, and I'll have you actually on the couch. So I'll have you put your head up this way. Okay. Okay, so I would look on the side for any lift heaves or lumps or any irregularities or asymmetry. Move the table over a little bit. Okay, so I'm gonna palpate your chest. I would palpate her chest and feel for any bruise or thrills. Okay, now I'm gonna listen to her apical pulse. I'm gonna listen for 15 seconds. To listen to the apex, you listen to the mid-clavicular line, 5th intercostal space. So I will listen for 15 seconds. Okay. And I would also listen for S1 and S2 sounds with my bell. Okay, and I'm going to listen for each heart sound also. And I would listen with the bell also. All right, could you lean to your left side slightly? Yeah, are you okay?
Yeah.
Okay, I'm going to listen with my bell of the stethoscope at the apex, which is the 5th intercostal space again. For murmur, S1 or S2 sounds. Okay, you can relax. Okay, and I would palpate her abdomen for any abnormal contour, asymmetry, any tenderness.
Nope.
Okay. I'm going to listen to her bowel sounds. So I'm going to start with the right lower and the right upper and the left upper and the left lower. Okay, and I'm also going to listen for any vascular sounds with my bell. Okay. I'm going to just lightly percuss her abdomen. Okay, everything, no dullness. And I'm just going to slightly palpate again for any lumps or tenderness. Okay. Now I'm just going to test your hip motion. So can you lift a leg upward and down? The next one, up and down. Okay. And now, can you bring your knee to your chest? Good. Okay, you can put one down and one upward. And now, can you lean it out to the side and inward and back in the middle? Okay, same thing with the other one. Now, up to the side, yeah, and back down. Very good. Okay, so now I'm gonna apply resistance when doing these motions again. So lift your leg up, push against my hand. Good. And the other one. Good. And now try and push against outward. Okay. And the couch is a little bit in the way, but that works. Okay. Now, so I would inspect her bilateral lower extremities make sure they're symmetrical, skin temperature, color, if there's any jaundice. Just make sure her hair distribution is normal throughout. I'm going to also palpate for her pulses. So do a popliteal pulse bilaterally. And posterior tibia bilaterally. It's fine. Or the dorsalis pedis and the posterior tibial behind the knee. Okay. And also if there is any edema in our bilateral lower extremities, which there is not. Okay, I'm going to have you just angle your feet this way so the camera can see them. And I'm going to test the range of motion of your ankles. So can you put your toes up to your chin and all the way down, out to the side, and inward. Good. And invert them, kind of cross them. Very good. And now I'm going to have you resist my hands. So push up and down, and the side, and inward. Okay. Can you curl your toes up and fan them out? And I can see them fanned through her socks, so that's good. And I won't make her, actually I'll remove your socks, I'm sorry. That's fine. You spread your toes. I would inspect the skin integrity and also cap refill for circulation. Okay, can you, it's a little bit awkward, make one foot and run it down your shin. Now all the way down. Yep, and now the other way. Ooh. Very good. Okay, I'll move those socks over. I forget what the Penske is. So, okay. Okay, I'm going to have you sit back up. Okay, no difficulty. Okay, you can stand up. Okay. I'm going to have you sit down again. I'm sorry. Make sure the camera is good. Okay. I'm going to test the range of motion of your knees. So will you extend your leg out and back? Okay, very good. And now just push on them again. And backward. Inside. Side. Good. Okay, you can just put your feet parallel. And I would test her with my instrument, which I don't have, deep tendon reflexes. The leg would go out. It's hard to indicate the spot. Go out. Okay, good. Okay. I'm going to get a piece of cotton and I'm going to have you close your eyes and just indicate, you can say now in the body part that I'm touching with cotton if you want to put your hands next to your side. Okay?
Now hand.
Yep.
Now cheek.
Yep.
Now foot.
Very good. Okay. Okay. So now I'm going to next. Okay, I'm going to have you put your hands out, palms up, and I'm going to write a number in your hand. Close your eyes, and you can tell me what number I write.
8.
Good. A.
A.
Yep. Okay, keep your hands out. I'm going to get an object, and I'm going to place it in your hand, and just tell me what it is.
Butterfly clip.
Good. And I'm going to get another object. Put it in your hand. And tell me what it is.
Rubber band.
Very good. Okay, you can open your eyes. I'm going to have you flip your hands back over. And I'm going to test your position sense. So I'm just going to have you close your eyes again and just indicate if your finger is upward or downward.
Upward. Downward.
And the other side?
Downward. Upward.
Yep, very good. Okay. So I'm going to have you alternate your hands up and down. Good. Okay, so I'm going to have you stand up again. So I'm going to just have you take a couple steps towards the back of the room. Just a couple steps. Okay, good. You can turn around. Okay, walk. I'm sorry. I'm going to have you walk heel to toe back towards the back of the room, heel to toe. Good. Okay. And I'll have you turn around and walk on your tiptoes. And also walk on your heels. Very good. Okay, I'm going to have you close your eyes. I'm just going to stand next to you and I'm just going to, for 20 seconds, measure if she's swaying. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Very good. You can open your eyes. She did not sway or anything. So I'm going to test your spine range of motion. So can you bend to the side and to the other side and forward and backward and twist again. Good. Okay, I'm going to have you pick one leg up and do a shallow knee bend. And back up and down. And now the other leg up, bend, up and down. Okay. All right, that concludes our assessment for today. So thank you very much. And I would wash my hands. And that concludes our assessment.
Thank you.
Thank you.